morning and welcome to the third and last day of our online symposium, recognizing, respecting, reimagining 50 years of learning from carers and shaping what comes next. My name is Lukas Hofstätter. I'm the Manager Research and Development at Carers New South Wales, and I'm delighted to welcome you today. This session has been developed in collaboration with our guest speakers, and it is wonderful to have so many of you joining us today. Before we start, I would like to open the session by acknowledging the traditional custodians of the lands that I'm joining you from today. For me, that's the land of the Gorgo people, and extend my respects to elders past and present from this land, as well as from all the traditional lands represented by our attendees today. Please feel free to add the lands that you're joining from today in the chat. Please note that today's session will be recorded and shared for on-demand viewing. We ask for the first part of the event that everybody who's not part of the panel, please mute your microphones and turn off your cameras so we can focus on the presentations and the panel discussion. We recognize that many carers and people with lived experience are joining us today. If anything discussed during the session causes distress and you would like support, a wellbeing officer will be available online throughout the event. Information on how to contact them will be shared in the chat right now. This event brings together participants from diverse backgrounds and areas of expertise. Our aim is to create a positive learning environment for all participants that is based on kindness and respect, where all perspectives are valued. You're welcome to add questions and comments in the chat, and we will be using the Q&A function afterwards. But if there's anything that you would like to discuss or that piques your interest, please feel free to comment in the chat. For some of you, this may be your first encounter with the Care Knowledge Exchange. This research translation project, led by Carers New South Wales, with funding from the New South Wales Department of Communities and Justice. This is our fifth annual Research Incubator Online Symposium, an event that over 3 days focuses on bringing together researchers, carers, policymakers, and practitioners to share the knowledge and learn from each other. As Carers New South Wales celebrates 50 years of supporting and advocating alongside carers, today's program focuses on shaping the future of care research, policy, and practice in Australia. This session on young care inclusion in practice invites us to reflect not only on the progress made over the past 5 decades, but also on the challenges still needed to better recognize and support young carers across education, health, workplaces, and community services. Drawing on research, practice, and lived experience perspectives, the discussion will explore practical actions service providers and systems can take to create a more inclusive and responsive environment for young carers, while also highlighting the importance of early intervention, participation, and long-term support to improve outcome for future carers. I'm very pleased to introduce our panelists who each bring valuable experience and a unique perspective across the field of young carer inclusion. To begin, I would like to invite our first panelist, Madeleine Buchner. Madeleine grew up as a young carer for her brother and mother, an experience that shaped her passion for supporting other young carers across Australia. As CEO of Little Dreamers Australia, she has dedicated her career to breaking down barriers and creating opportunities for young people with caring responsibilities. Madeleine brings both lived experience and leadership to her work, alongside an inspiring story of resilience, advocacy, and positive change. Welcome, Maddie. Secondly, Lily Brown. Lily is a young carer for her younger brother, Philip, who lives with profound intellectual disability and autism. Currently studying a Bachelor of Communications and a Bachelor of Law at the University of Technology, Sydney, Lily is passionate about advocacy for young people and young carers. She has been involved in several advisory groups, including the Carers New South Wales Young Carers Advisory Group, and is committed to using her lived experience to help shape more inclusive and supportive systems for young carers. Welcome, Lily. And last but not least, Sarah Abi-Khattar. Sarah is an experienced social worker and project officer who is passionate about supporting young carers and strengthening outcomes for communities. In her current role as Young Carer Project Officer within the policy team at Carers New South Wales, she works closely with young carers through advocacy, community engagement, and support initiatives. Sarah brings a warm and practical approach to her work, backed by experience across the community sector and studies at the University of Sydney. This session will start off with statements, short 15-minute presentations, first from Maddie and then from Sarah and Lily, and then we will move in a discussion afterwards. So again, if you would like to ask any questions of our panelists, if the presented brings up any thoughts that you would like to discuss, please put them into the chat. And now I'll hand over to Maddie.
Thank you so much. I'm so excited. I am going to share my screen. I've got a presentation, but don't worry, we will share those slides with you all afterwards. So I'm hoping that you can all see that. So as Lukas said, my name is Maddie and I am the founder and CEO of Little Dreamers, which is a leading organisation in Australia that delivers direct support to young carers here. I was also a 2024 Churchill Fellow, and as part of that, I did some research into what does best practice look like. What does best practice look like when it comes to young carer support, not only in Australia, but also around the world? So I will go through a little bit of my findings from that as well. I wanted to start off by acknowledging the traditional owners of the land on which we gather. I am in Melbourne. I'm on the lands of the Wurundjeri and Bunurong people of the Kulin Nation, and I want to extend that acknowledgement to the traditional owners of the lands that you're all on and acknowledge that sovereignty has never been ceded, and this was and always will be Aboriginal land. As we all know, I'm not going to touch on this for very long, but a young carer, Little Dreamers works with young carers between the ages of 4 and 25. And we define a young carer as someone who currently provides or intends to provide care, support, or assistance. So what that means is that we can support a young carer from an early intervention lens before they actively provide care, to be able to start empowering and building skills and resilience to help young people take on those responsibilities when they do provide care. We did some research last year through Little Dreamers just on some key statistics and updated information for young carers. Some of these stats are ours, some of them are not. So we know that there are 2 to 3 young carers in every single classroom across the country. Based on the Little Dreamers survey last year, 58% of young carer families usually or always worry about money. We know that financial disadvantage is a big thing for young carers and their families. We know that young carers are up to 1.5 years behind in their NAPLAN scores. That also was not a Little Dreamers statistic, but what was that 39% of young carers are reporting missing school at least once a week due to their caring responsibilities. A little bit about Little Dreamers, in case you haven't heard of us before, we are dedicated to improving the quality of life for young carers across Australia. We deliver a range of direct support programs, both one-on-one and group programs, short-term and long-term, that aim to support a young carer across their education, employment, mental and physical health, social well-being, and financial literacy as well. One of the things that I have found over my time in the young carer sector, and I've been working in this sector for 17 years now, is that Australia, in the way that we include and practice support for young carers, sits very much in between 2 key countries in the world, the US and England, when it comes to supporting young carers. We have growing recognition in Australia, but we have absolutely no enforceable or system-wide approach. And I want to talk about a few of those things today around what we've seen around the world happening, but also what we have in Australia. So as I mentioned last year, I did some research around the world into what best practice looks like when it comes to young carers. And I started in the US and looked at what does an emerging market look like for young carer support. The US has a lot of innovation, but absolutely no structure to their support. So I looked at some key models that are very reliant on grassroots people and grassroots action in the US, and compared that to what we have in Australia. So some of the 2 key two of the key programs in the US is the Caregiving Youth Project in Florida, which works in a very specific part of Florida called Boca Raton. The Caregiving Youth Project goes into high schools and supports young carers through a survey at a year 9 level where students can self-identify and then they can go into one-on-one support and group-based programming. It was really interesting. It is a very person heavy model. Like it relies on a lot of personnel to be able to run the model, but the impact of it by going into schools, getting students to self-identify, and then also having both the mix of one-on-one and group-based programming seems to work quite well. And then there was also a model at the Rhode Island Department of Education where it is very department led, where the Department of Education is helping schools to create policies and systems and peer support groups that are set up for that school environment. And that was really interesting because it is obviously a government and department-led program, but it is very much a train the trainer model. How do you get the school to identify what works best for their school community, and then how do you get them to implement in a way that works for them? So the two key things that I've seen from a young carer inclusion lens from the US that work really well is school-based identification, which reaches those hidden young people. What doesn't work so well is that it is a very fragile system and very reliant on individual champions, which means that if those people stop working within the care sector or things change, then it doesn't seem like there would be any longevity of those services. Then I'm comparing it to England, which is widely recognised as the leading young carer sector and country in the world. England has statutory duties that need to be followed under the Children and Families Act. They have a young carer marker in National School Census. They have examples of these things that we're calling mainstreamed approaches. So how do you support young carers, not only within the carer sector, but also in health, education, home, housing, food security, justice system? How do you make sure young carers are picked up in all of these areas? That is what it seems like is a best practice model. It means that young carers are not falling through the cracks, and it means that young carers don't need to self-identify to get support as a young carer. The other thing that I think is really powerful when we're talking about this topic is youth action groups and how they are really influencing policy. And I know I'll go into that a little bit more, but I know Sarah and Lily are talking about that quite specifically and how we can learn from our young carers in really practical ways that can be implemented in an ongoing manner. In Australia, what I found quite interesting over the years is that Australia has recognition in law, but in practice, young carers are still quite invisible. So we have the Carers Recognition Act. We know it needs to be updated, but it does acknowledge carers of all ages. It just has no enforcement. So we have the basis of it. We just don't have the enforcement and the practice. In 2023, there was also the parliamentary inquiry into the recognition of unpaid carers here in Australia. That did shine a very big light on young carers. In the recommendations document that came out of the government, young carers were mentioned 64 times in the report. Unfortunately, when the government response came out, they were only mentioned 3 times. And so once again, we see that disparity between we're starting to see things get recognised and we're starting to see young carers get included in these spaces, but the follow-on practice seems to be lacking a little bit. And so I think that's where Australia needs to be focusing and where we as a community and as people who are on this webinar and listening to it later can be focusing on how do we put into practice the things that we have. In Australia, we also don't have mandatory identification or a national data mechanism yet, but I do think we are on track to get something like that. When I was in Manchester last year, I studied this model of participation called the Lundy model of participation, which asks 4 questions. And I think that's really important to include when talking about how do we include young carers in practices and in services and in systems more equally. The 4 questions are, have you created space? Have you enabled voice? Have you guaranteed the right audience? And have you ensured influence? So who's in the room? Who's listening to these young people? But also, have we created the right environments for our young people to participate properly? And how are we making sure that we use their voices and their experiences in the right ways? In practice, I wanted to call out a couple of different models that I think are really interesting. Sheffield Young Carers, based over in the UK, has things like 50% of their interview panels are young carers, and they have equal decision-making power. So those young carer people on the panel need to also agree with the staffing on the panel and make sure that they both find an equal middle ground. And I think that's a really interesting model. The Young Carer National Voice also is a UK program. There are 24 different services that all come together to run an annual campaign for young carers with direct access to members of parliament. And it's the power of bringing those services and young carers together with a really clear aim and goal that seems to have the uplift and the follow through that it needs to have in the UK. And then Little Dreamers also has a Young Carer Advisory Committee, which we aim to co-design, get board input and provide feedback and advice up to the board, and also provide in public support in public advocacy. The biggest barrier that I've seen when it comes to young carers not being included effectively is the barrier of adults letting go of power. How do you make sure that adults are letting go of enough power to provide the room for the young carers to actually have a voice and for that voice to be useful? And I think there are lots of ways we can do that, but I think that's where the crux is at the moment. So what must change is we need to mainstream young carers. We need to be providing support beyond respite. So a lot of the support in Australia is respite specific, holiday programs, overnight camps, having young carers out of the home. But how do we make sure that we're providing support beyond that? We need to be providing or having a look at a whole of family model. How do you make sure that young carers are seen as a whole part of a family? And if we are providing additional support for another part of the family, will that actually take the burden off young carers and allow some of those risk factors to reduce? How do we make sure we embed lived experience leadership properly and not just tokenistically? How do we make sure that the sector has a legislative safety net, something to fall back on to hold the sector accountable? And how do we have inclusive research and data? And I know there are lots of people from lots of different sectors on this call, so I'm just going to go through some key things that we can do in each different sector to ensure that we're including young carers in ways that feel good and ways that are not tokenistic. So from a government lens, I believe the governments have a really pivotal role to play in embedding young carers into the fabric of policy, legislation, funding and service delivery. So while we have both at state levels and federal levels, very specific carer departments and carer teams that look after adult carers, they also look after young carers. A lot of the time, those services are designed for adults and adapted for young people. But we also need young carers to be acknowledged, identified in other departments and other portfolios. We think education, health, disability, justice, youth, economic, housing, food security as well. The young carer sector, and everyone on the call who's working in the young carer sector, it's really important that we all build relationships and support and collaborate to deliver support. And we need to step in where government systems fall short. We need to make sure that, with fragmented, underfunded and competitive funding cycles, that we are being really innovative as a sector and leaning on each other for support as well. And also to ensure that young carers are supported and caught irrespective of where they are in the system. If you were listening to this call from another sector in the community, we need to make sure we're embedding simple practices into existing programs and environments to not only identify young carers, but also make sure their voices are included. So if you have a youth advisory group, making sure that young carers are included in that. If you're doing consultations on anything, whether it's to do with disability, aged care, healthcare systems, make sure young carer voices are included in that. And also make sure that you have an identification question on your application for support or your assessments to make sure we're picking up young carers along the way. From a research and data perspective, England and the US have definitely made it easy to identify young carers in key setting, so schools particularly, it's really important then in Australia we are focusing on how do we count and represent young carers in new and different ways and make sure that they are counted in really large national policy data sets, as that's going to be the thing that has the influence at a government level. And I think that's going to be a lot of people talking about it a lot of the time, but also finding how we can implement questions about young carers in existing surveys rather than creating new ones. And if you're listening to this call and you are a young carer yourself, just like I was growing up, and now I'm just an adult carer, you have the right to tell your story and be supported in your caring role, but your caring role doesn't need to be the entire part of your story, and making sure that you have the same opportunities as anyone else in your life and that you reach out to support for other people, but knowing that your voice is really, really powerful and needs to be a part of the change to make that happen. One of the things that I thought was really interesting to finish on was that young carers have been recognised in Australia since the 90s. Young carers are no longer hidden in key areas, in key policies and things like that. We're actively choosing not to see them now and not to look for them because as a country, we've known they've existed since the 90s. And I think that's a key thing we need to change to make sure that young carers are properly included in practice. That's a bit from me. I'm going to hand back over to Lukas now, and to Sarah and Lily, and I'll be back to answer any of your questions later on.
Thank you, Maddie. Thank you, Maddie. Thanks so much for this very insightful presentation. It's great to have sort of an international overview to see where Australia tracks relative to other countries. That always, like in sports, might be a good motivation to move forward. And moving forward, we are to the presentation from Sarah and Lily, who will talk about a very specific way of supporting young carers and amplifying their voice. Sarah, over to you.
Thank you so much. All right, so as Lukas mentioned, my name is Sarah. I am the Young Carer Project Officer at Carers New South Wales, and I am joined by the amazing Lily, who is a Young Care Advisory Group member who'll be sharing her story and her experience being on the advisory group with us today. So I'll talk to some slides and then I'll pass over to Lily and I'll come back and finish up the presentation. So I'd also like to acknowledge the traditional custodians of the lands that we're meeting on, and I'd like to pay my respects to elders both past and present and extend my respects to any Aboriginal Torres Strait Islander people joining us on this call today. So I might touch on a few points that Maddie already mentioned, which I actually think is a really good thing because I think it helps reinforce our key messages around young care inclusion. But I wanted to start my presentation this morning talking a little bit about the work we've done over the last 50 years with our engagement with young carers at Carers New South Wales. So, here at Carers New South Wales, we genuinely want to include young carers in the work that we're doing. It's essential to understanding and responding to their lived experience. So when young carers' voices, as we know, when they're actively heard and they're valued, the support that we can design across all systems becomes more meaningful. So after, I guess, over the past 50 years, our engagement with young carers has very much evolved. And I think the evolution has taken place and has been shaped by the many changes in the funding landscape and also across the broader sector. So in the early years, our focus was very much on providing direct support to young carers, offering camps, recreational activities and programs, which gave young carers a chance to connect, get together and have a bit of a break. And then as funding models changed and the sector shifted, I guess so did our approach. So we moved away from delivering the specific kind of direct support programs at the time and instead worked quite closely with other organisations to help expand opportunities for young carers statewide in different ways. And more recently, our role with young carers has evolved pretty much into the policy space and that systemic advocacy space, ensuring that young carers' lived experiences drives that systemic advocacy, the policy development, and that sector-wide change. So as the landscape has shifted, so has our understanding of supporting young carers. So we know that meaningful change across all sectors, but meaningful change for young carers truly starts with listening to them. Including young carers in the work that we do and in our practice is absolutely essential. We know they're the experts of their lives. Without their voices, without listening to them, we risk overlooking what truly matters and what genuinely works. It really is fundamental that we listen actively to young carers. So it's really important we listen because I guess despite the growing awareness of young carers across the different sectors, many of young carers are still, they remain unseen, under-recognized, not identified, which can have some severe impacts. We know that outcomes are still falling short. The data pretty much tells us that there's a lot more that we can do. And hearing Maddie speak about the different models that other countries have implemented to support and include young carers, I think we can safely say that there's a lot more that we can do here. And we often hear from young carers that services don't always fully recognise or understand their lived realities. So I guess without their input, the supports can sometimes overlook the complexity of their experience, making it a little bit harder for them to access and sometimes not super effective when they're accessing those supports. So I guess, yeah, we know that listening to young carers leads to supports that are grounded in their lived experience and can deliver stronger outcomes for them. So building on our commitment to listening and drawing on our experience engaging with carers more broadly, we established our wonderful Young Carer Advisory Group in 2022 to ensure that they were not only heard, but they were actively involved in shaping the work we do at Carers New South Wales, and of course, more broadly. So the YCAG, which is short for the Young Care Advisory Group, the YCAG, I guess, brings together a group of young carers from 16 to 25 years of age across the state, across New South Wales, who, bring their stories, their lived experience to help shape policy, research, service delivery, and really guides how inclusion can show up in real practical ways. So through the YCAG, the amazing young carers share their insights on emerging issues that are affecting them. So I will talk soon a little bit about some of those issues that they bring up and discuss in those meetings. They contribute their ideas and provide feedback on some of our internal projects, programs, resource development. And the YCAG also creates a really awesome direct pathway for government departments and different agencies to hear directly from them, so that they can influence the work that they're doing as well. So it's not only shaping the work that we're doing at Carers New South Wales, but it's having some wonderful impact on the work others are doing in the sector more broadly. So really at its core, the YCAG ensures that young carers do have an influential voice, and making sure that their voice is having a direct impact in the decisions that affect them, which I think is really important. So just a little bit about what the YCAG involves. What does it look like in practice? So I guess before every new term begins, we ask young carers to apply via an expression of interest for those who are interested in kind of taking that leadership role and being involved in that systemic advocacy. And then the young carers who are selected to join the group will join for a 12-month term. So it's a 12-month term commitment. They meet quarterly for 90 minutes online. Generally, these meetings are scheduled after hours to fit around school and work and other commitments. And each meeting includes a consultation component. So Carers New South Wales staff members and external stakeholders can seek that direct input. They can bring their work to the group and ask them questions. And it's wonderful because the group always provide the most honest and respectful feedback. But it's really good for people to receive that feedback and then action that. The young carers are offered out of session opportunities as well. So sometimes things come up between meetings and then that's optional. So they can opt in if they want to be part of that, depending on availability. There is a terms of reference, which supports, I guess, a structured approach and helps the young carers build some professional skills. And then at the end of every term, we evaluate and make changes based on the feedback that we receive. So sometimes there's things like feedback around meeting times or the length of meetings. So we refine that and action their feedback where we can. And we've also introduced a young carer co-chair to these meetings, which I think has been really important in strengthening a more carer-led approach. We really want to make sure that young carers are supported to participate in the group in a meaningful way. We really don't want things to ever be a ticker box. We want to make things meaningful for the young carers as much as we can. So to support that, we offer young carers in the YCAG an opportunity to participate in our carer representative training, which is training that helps them build skills to share their lived experience safely, meaningfully, as well as supporting them to get a deeper understanding of advocacy. We provide ongoing support and coaching throughout the term to help them feel prepared for consultations or for any opportunities that may come up for them. And importantly, we really value young carers' times and expertise. And a way to show this, to show how much we value that, we do provide a sitting fee for young carers who attend the meetings and for any extra work that they contribute to. Something else that I think is really important is that we make sure that we support young carers to prepare for consultations. So if we do have an upcoming meeting and we have a consultation, I think it's really important that we share information about what that consultation is and give some questions to help prepare them for involvement in the consultation. And this term will be offering a certificate of participation to potentially help with future employment opportunities. So I think that's a really good addition as well. And so while some of these supports have been in place from the very beginning since 2022, others have been developed over time through ongoing, I guess, quality improvement and actioning feedback from the group. So I wanted to share a few gaps and challenges that the YCAG have identified themselves and discussed mainly this term, but no surprises that most of these challenges and gaps have come up pretty much every term. But the main challenge the group continues to bring up is around the lack of identification and recognition for young carers. So, we know that if young carers aren't identified or acknowledged across key sectors, across all sectors, they're most likely going to miss out on supports and opportunities for support. And that's something that, that identification piece is something that is extremely significant when it comes to young carer supports, because there might be supports available, there might be services available, but we know that if a young carer isn't identified or they don't recognise that they are a young carer, it's less likely that they're going to access those services, and there's a high chance that they'll miss out on that. The second challenge the group has spoken about is around the impact of financial pressures. These pressures are increasing for young carers and their families, and it's really highlighting the need for targeted financial support and practical assistance for them. Another key issue that has been identified by the group is around the need for more tailored support and resources. So there's a lot of resources and great work out there for young people in general, but I feel they feel that there needs to be more tailored supports and resources specifically for them and their circumstances. So we know that there are services out there, they may not always meet the needs of young carers. Sometimes they may lack the age appropriateness, they might not be culturally responsive all the time, and they may not offer that flexible support option. And lastly, fragmented services responses, I guess, present as a challenge. So, sometimes support for young carers is often disconnected between sectors, which can lead to inconsistent pathways, placing the burden on young carers to navigate a very complex system on their own. So the YCAG plays a really important role in making sure that our work is guided and shaped by real perspectives of young carers. The YCAG is an incredible group who've achieved so much over the years, and I just wanted to take a moment to highlight how they're creating real impact. So not just, nationally, but even internationally. And here are just a few of these achievements that I wanted to share. So the group supported some of our resource development. So one of the main resources they were involved in a few years ago was the development of YC Bites, which is a podcast. And we had young carers involved in that. And we also had a young carer advisory group member host one of the seasons as well. So that was really cool. They've shared their lived experience globally. So they've also met with international researcher, Professor Mary Larkin, which was awesome. They've influenced national conversations. So they've contributed to the draft Commonwealth Young Carers Charter. They've informed key policy and advocacy work, like being involved in consultations on the Carers New South Wales pre-budget submission, and of course the amazing National Carer Survey. And one recent example of impact, which I really wanted to highlight because I think it's so cool, is that the YCAG have told us repeatedly that our digital engagement with young carers really needed to improve, and it also needed to be carer-led. So we listened, we brainstormed, we came up with a solution, and we were able to secure some funding for a short-term contracted position, a young carer digital impact officer. We created a role which is really cool. We have someone on board, and I think it's a great example of how we turn their feedback directly into action. So just wanted to share that with you all. And so while these achievements are significant, I guess the true impact of the YCAG is reflected in the opportunities that it creates for young carers to grow beyond the group. So yes, they're doing amazing work within the group and to support our organisation and others, but it's really cool to see them grow and flourish and do things outside of the group. So being part of YCAG really helps with their confidence. It develops their leadership skills, advocacy skills. It supports them to represent young carers' voices externally. And and you'll hear Lily speak a little bit about an event that, Lily attended. And for some members, their involvement in the YCAG has actually supported employment outcomes, which I think is also a really cool thing. So we've been able to connect them to others through our networks and through consultation work. So, the YCAG doesn't just, I guess, inform change, it empowers young carers to lead it and take charge, which is awesome. But to truly understand the value of our awesome young care advisory group and this model, it's best that we heard directly from someone involved. So I'm very pleased to introduce Lily, who, as I mentioned, is one of our YCAG members. And yeah, take it away, Lily.
Thank you. Hi, everybody. As has been mentioned, my name's Lily. I'm 17 years old, but 5 days away from being 18. I live in Kanahuka on Darwell land, and I'm a first year uni UTS student, and I'm doing a double degree of communications and law. I care for my younger brother, Philip. He is 16 and he has a profound intellectual disability, level 3 autism spectrum disorder, and he is nonverbal. I'm currently on the YCAG and I am also on the Illawarra Shoalhaven Local Health District Consumer and Community Council, which is a very long name. I've been caring for my brother since I was around 7 or 8 years old. I don't have a specific timeline, but that's as far back as I can remember. But I did not know that I was considered a young carer until 2024. So when I was 15, I think. I attended the New South Wales Youth Summit, as a part of a different council. And when I was there, I met two young carers who were on and are currently on the YCAG. And after speaking to them, I learned that there was actually a name for the role that I played in my brother's life. And I guess that I always knew I was looking after my brother, but I kind of, in my mind, just considered it babysitting and that it was normal to look after my younger siblings. But I have since learned that it is a very different role than my friends. Yeah. After attending the youth summit, I got in contact with Sarah and I got the opportunity to do a few social media campaigns for Carers New South Wales. By the time the EOIs came out for the current YCAG, I applied and got in. So I'm currently on this year's YCAG. Yeah, it is. I really enjoy it. We get to be involved in many consultations on issues and frameworks that directly impact young carers. And I get to focus my passion towards shedding light on the concerns that we have as young carers. From the YCAG, I've done a series of young carer awareness sessions, or YCAS, where I get to share my lived experience with organisations to raise awareness of young carers. These sessions are great at planting the seed and helping different sectors see just how many young carers there are, how to recognise us, and how to support us. Further, I've had the opportunity to go to Parliament House in Canberra as the New South Wales Young Carer representative. So one young carer from each state in Australia got to attend Parliament, and it was basically a barbecue, but speaking to senators and advisors on issues that are affecting us and also possible kind of visions for change to help improve the support systems and improve policy for young carers. It was a very cool experience, something that I wouldn't have got the opportunity to do if I wasn't in the YCAG. So I'm very grateful for that and excited for future opportunities. Being a part of the YCAG has impacted me in many positive ways. I feel a strong sense of fulfillment for the advocacy that I get to do after each session, even if it's consulting on an issue that doesn't necessarily affect me. Being able to speak on behalf of young carers and really advocate for their needs is something that I don't take lightly, and I'm very grateful that I get to do that. I feel a lot more confident about speaking about my experience as a young carer, both with my friends and any person who is interested in listening to me. So thank you, all of you. And I think after each session, both in the YCAG and in the Young Carer Awareness sessions, I get a little bit better at articulating myself and my hopes for young carers in the future. Following a YCAG meeting where we consulted on the Carers New South Wales pre-election priority areas, I have self-initiated further advocacy and am currently in the process of writing to my local MP to raise the need for a carers card, which is something that will help recognise all carers in a literal sense, and I'll speak a little bit more about it in a bit. But I'm proud of myself for saying yes to these experiences and cementing myself as a young carer in all aspects of my life, not just in the council. It's so important that young carers have a say in the decisions that affect them because we are the people with the direct lived experience of caring responsibilities. Young carers often balance school, work, friendships, and their own well-being while supporting the person that they care for. So they understand the real pressures, challenges, and supports that policymakers or organizations may overlook. This ensures that any change or decisions that occur are relevant, practical, and supportive rather than based on assumptions, which is why it is very important that young carers are in the room. When young carers' voices are truly centered, it can lead to more effective support systems, better health outcomes, both physically, mentally, emotionally, and can create stronger feelings of inclusion and empowerment, which is something that young carers across the state lack. Young carers are more likely to feel valued and respected rather than being spoken for, which can improve trust between carers and organizations, as our perspectives help shape policies that are more accessible, flexible, and compassionate. From my perspective, meaningful engagement with young carers looks a bit different to how it looks now. I think having dedicated young carer representation in advisory groups like the New South Wales Carers Advisory Council would be beneficial, as young carers should always be involved in the discussion. I think it's so amazing that Kiara is here and she's going to share her experience as a young carer on the New South Wales Carers Advisory Council. However, I think there should be a mandatory position on the council held for young carers. One part of my advocacy journey that has been extremely fulfilling and that has allowed me to voice my concerns as a carer is when I got to visit Parliament House. I think there should be many more national opportunities, not just to bring those young carers together, but to also cement to all levels of government and other sectors just how widespread and similar the issues are that we face as young carers. Yeah, and yeah. I think the level of engagement at the moment is super low because young carers often don't realize that they're young carers. It took until I was in year 12 for me to realize that I was a young carer, and I only was lucky to realize that because I attended the youth summit. But a lot of young carers who aren't in the position to be a part of these councils or are even aware that they exist, they're not getting those opportunities or that kind of like awareness is spread enough so they can realize that. So there needs to be way more recognition, awareness, and support in primary school and high school. I think younger carers, so primary school aged carers, are often forgotten in these conversations. I know from my experience, I was the primary carer when I was in primary school, and that was like impacted me a lot more then. So me kind of finding out at the end of high school wasn't the most beneficial to me because it would have been a lot more helpful 6 years ago. And yeah, if I had been taught what a carer was at the height of my struggle, and I probably would have felt a lot more comfortable seeking support, but I just didn't speak about it. I don't think it's on the teachers to teach us, even though they should be aware of what a young carer is. It's on peak body organisations like Carers New South Wales and Carers Australia to get involved and go into schools and go into different communities and not just be an invisible resource for young people. However, they cannot do that if the Department of Education does not let them. So therefore, it is also on them to allow the young carer awareness sessions and other initiatives into the school setting to further advocate and plant the seed for young people. If they're not receptive, then and don't also put in the effort to make these resources accessible and provide funding for it, then young carers will continue to feel invisible and isolated. Meeting young people where they're at is important, as they cannot create a supportive environment for them to seek support, as it can not only create a supportive environment for them to seek support, but it can also teach other young people around them to advocate for their friends and their carers in their life to help them out. I think at a government level, the first thing they should do is to introduce a New South Wales carers card as a form of recognition for carers, and to finally acknowledge the issue that Carers New South Wales has been advocating for almost a decade. A carers card will enable carer identification and recognition, which is one of the key issues raised by young carers. And the introduction of a New South Wales carers card would provide formal recognition of a person's caring role and increase community visibility and inclusion across service systems, businesses, and government. I think more resources should be allocated to support organisations like Carers Gateway or the Young Carer Bursary Program, and such as more funding and way more promotion. Being a young carer has shaped who I am and has helped me to be patient, understanding, and empathetic. Being a young carer is a crucial part of my identity, but it does not mean being invisible or unsupported. What needs to change isn't complicated, and it's not the first time we as a young carer collective have brought it up. Listen, recognise, and include. And also more funding towards support and participation, please. Service providers can start by asking the right questions by first conducting research. They can offer flexible support, as not all young carers have the same needs, and they can design services with young carers and not just for them. Thank you.
Thanks so much, Lily. So appreciate you joining us today and sharing your wonderful insights. Yeah, really appreciate it. I'm very mindful of time. I did have a couple more slides to get through, but I'm definitely not touching tech anymore today. So I just wanted to do a very quick, humble, I guess, promo, and just let everyone know that the YCAG term is finishing up at the end of next month, and we have a new YCAG term starting in July. So if anyone knows any young carers who would like to be part of the YCAG, feel free to reach out. I'll pop my details in the chat, but the information is on our website. So thank you so much. Thanks, Lily.
Thanks, Lily and Sarah. And Maddie, of course, for your presentation as well. As Sarah said, I'm also a bit conscious of time. We were looking to move a bit to a panel format, which we'll still be doing. It is just that I will prioritize the questions that have gone through the chat, and it is really great to see that there was quite some engagement in the chat. There was one question, I think, Maddie, that was for you, from Trevor Rowe, about the young carer voice, I believe, in the UK. How do they have direct access to the MPs over there?
Yeah, it's a great question. In the UK, they have identified some really key political champions. So there are key politicians that have really come out, identified that they would like to champion young carers, and they have helped to provide a direct line to other MPs. So often the Young Carer National Voice, the organisations that are represented, the 24 services, all have relationships with members of parliament that they can go to directly. And then the other key, I guess, champion politicians help them to access other people. And I think that's one of the things we don't have in Australia. We don't really have political champions that I guess have come out and said, I'm going to stand for young carers and I'm going to make that my mission, is to improve support for young carers along the way. And I think that's one of the things we really need, but that's how they've done it in the UK.
Right, thank you. That's definitely something that we could learn, have politicians really put that on their flag and fight for young carers and have a direct line. That would be really something great. A second question then came in through the chat, and I think there was in regard to Sarah and Lily's presentation, but feel free to chime in, Maddie. Jackie would love to hear some examples of how the advisory group's feedback has helped shape government departments' work, if possible. And I would like to extend that to sort of a question more generally. Can you name sort of really positive examples of awareness raising and of inclusive services that you've come across, or inclusive schools that you've come across in your practice, sort of through the YCAG, or Maddie, if you know of a particularly sort of lighthouse example of a service or a school that does young care inclusion really well. Sarah, maybe do you want to start us off?
Yeah. I think the first thing that comes to mind around the kind of government or impact for government is around young carers being included in the New South Wales Youth Summit report. I think that was really incredible. We had 3 young carers that we knew attend the summit, and the recognition there, I think, was great. The YCAG, I guess, also had influence and impact in the New South Wales regional New South Wales Young Carer Skills Project. So that was a project that the YCAG had some feedback and input on. So I think they're the first 2 things that come to mind. In terms of kind of what we see works well, I'll throw to you, Maddie, and then I can chime in if needed.
One of the other government initiatives that we've seen work really well from a young care advocacy and young care voice perspective is the inclusion in Victoria of young carers on public school enrolment forms. So now you can identify as a young carer on an enrolment form at when you're enrolling for a Victorian public high school. The challenge is that that doesn't really go anywhere at the moment, but the fact that the question is there, I think, is something that we can celebrate and we can look at as being a movement from a young carer voice perspective. We just need the what happens after someone identifies part. Some of the cool things that I've seen in terms of best practice for young carer voice, I do think in Australia, some of the joint work that organisations like Carers New South Wales and Little Dreamers and a few others have done, Satellite Foundation have worked together to do some advocacy pieces together. I think that's worked really well. And I think overseas, I talk a lot about Sheffield Young Carers and the Young Carer National Voice Project, but I do really think everyone should go and look at it. I think we need something like that here. Young Carer National Voice, bringing all of those representative organisations together with an organisation and a young carer from every service. I think that's something that we have the potential to do here, and it's something that we should. It's just finding out how we do that. But I encourage everyone to go and look at it. The website is incredible and the resources are amazing.
That's awesome. And just to add to that, I do think, our young carer awareness sessions that Carers New South Wales offers to schools and services are really impactful. I think the challenge, though, is getting our foot in the door, and that's always been the challenge. Lily mentioned the Department of Education, and so it takes a lot. It's almost like it needs to be, top down for us to continue that awareness raising. But once we're in, and once educators and schools hear about young carers, I do feel like they want to make change and really implement some supports for young carers who are balancing education and other things. So I do think those, information sessions and awareness raising pieces are really impactful.
Thank you, Sarah. I'm aware we are on time. Thank you all who have participated in the chat. I would like to close this session maybe with a quick whip around the room. One sentence that people should take away from this session, no more than one sentence from each of you, if that's possible. Maddie, why don't you start us?
I think young carers are going to change the world, and I think they have the skills to do that. We just need to make sure they have the platform to do that properly. But I honestly believe young carers are going to be the people that change the world.
Great. So what's the takeaway? Young carers need a big platform. Sarah,
This is hard for one sentence, Lucas. But I think for me, I really want to highlight, and I said it multiple times in the presentation, please actively listen to young carers. Their lived experience is so important. And yeah, don't just listen, act on what they're telling you.
And Lily, would you like to have the last word?
Sorry, it was not letting me unmute. I guess, yeah, young carers' lived experience is important and should be involved in every conversation about us. And I guess I'll repeat something that I wrote: listen, recognize, and include.
Amazing. Thank you all so much for today's session. We're a bit over time. The event finds its conclusion at 11:30 with a panel discussion on basically the reflections on 50 years of care in New South Wales, 5 wins and 5 priorities for the future. Thank you, everyone who joined us today. Thank you for the discussion in the chat. And see you at 11:30 on the same Zoom link. You will have to log in again. Thank you so much and have a good day.